Europe is struggling to contain Covid-19. Infections are increasing, so are restrictions. And the Dutch Prime Minister says it's the only way. We have to be stricter. But is it the only way? One country has offered an alternative.
I think Sweden got it more, yeah, basically, except they didn't do it right in the beginning, but basically they got it right.
So is Sweden getting it right? This is one of the big questions of the pandemic. Hundreds of articles have been devoted to it with wildly different conclusions. Times analysis says the Swedish response is a disaster. It shouldn't be a model for the rest of the world. But look at this from the WHO in late September. It says we must recognise that Sweden at the moment has avoided the increase that's been seen in some of Western Europe. We will be very keen on hearing more from the Swedish approach. Well, what is the Swedish approach? Put simply, when many countries went into lockdown in March, Sweden didn't. Instead, it pursued voluntary social distancing. It encouraged a range of things, working from home, avoiding public transport, table service in bars. And that advice rested on the assumption that people feel like this.
We in Sweden trust the authorities, and if the authorities say stay at home, please, and work from home, we do that. So they didn't need to say you have to go on a lockdown.
Sweden's calculation is that people will social distance effectively if the message is simple, credible and consistent. Also, the Swedish approach doesn't include masks. Officials argue they give people false confidence, which sometimes undermines social distancing. And all of this is designed to move Sweden towards a goal that it shares with other European countries: how to reduce contacts between people. You'll hear this referenced again and again.
The number of social contacts and travel movements must be drastically reduced.
If during these 6 weeks we follow the curfew, we act collectively to reduce the number of contacts, that's the point at which we think we can progressively start to open up again.
Because reduce contacts and you reduce the risk of transmission. And relevant to that is the role of the superspreader. It's thought most COVID infections are transmitted by around 10 to 20% of people who have it. This Danish epidemiologist argues Sweden understood this.
A full lockdown would be too much. You need to look at these super spreaders and limit them, and that's basically what Sweden did. The most visible or actually the only really intervention they did was to say that your max gatherings was 50.
So that's Sweden's approach, and to assess it, of course, we need to look at how the numbers compare. I'm going to focus on 3 measures. First, Sweden's total deaths per capita is the 15th highest in the world, higher than most major European nations. Second, when it comes to the total numbers of cases per capita, both Norway and the UK have lower figures than Sweden, but Spain and France have higher. And third, the infection rate. Sweden has so far avoided an autumn surge, but its infection rate is higher than Norway and Germany, and it's rising. This all feels a long way from the success story some would describe. And there are other issues too. Some critics argue the whole thing is actually a misjudged plan to achieve herd immunity, something that's strongly denied. Also, Sweden's approach has relied on thousands of vulnerable people shielding themselves while others live under lighter restrictions. And Sweden's number of deaths was in part driven by a failure to properly protect care homes. But the man who devised Sweden's approach thinks in the long term it will work.
In part, we in Sweden have always had the same regulations in place, the same recommendations and general advice, and they still apply. I think it creates a sense of security and a long-term perspective, and then it is easier to follow.
Consistent, long-term, consensual, this is Sweden's mantra, and at the heart of that is a commitment to the social contract, a contract that requires trust between people and national decision makers. You could argue without it, any COVID strategy will struggle. Now, as we've seen, there's nothing in the data to show Sweden is definitely getting it right, but this emphasis on trust and consensus feels relevant as European governments once again change the rules by which people are living.